Brendan Hall, and can you believe it? This weekend marks the 3rd anniversary of Mississippi's first COVID-19 case. 3 on your side's Holly Emery joins us now with a look back on what everyone had to endure during the early stages of the pandemic. Holly.
That's right, Brendan. You might remember where you were on March 11th of 2020 simply because it was the beginning of what is now our new normal. But let's take a look back on what's happened and see where we're headed.
Now we've identified our first case of COVID-19 in Mississippi.
That statement came to you exactly 3 years ago this weekend, the day the COVID-19 pandemic came to the Magnolia State. Dr. Michael Threlkeld with Baptist Memorial Hospital says experts had no idea what was coming.
When we heard about the first few cases, we all said, no, that's interesting. I wonder if that'll amount to anything. And never thought that, 3 years later, we'd be still sitting here talking about it.
In a matter of just days, Governor Tate Reeves declared a public health emergency. Schools pivoted to virtual learning, and the virus claimed the state's first victim. In April 2020, Governor Reeves issued a shelter-in-place order to keep cases from rising further.
We are close to our peak resource use. The best available model says that it is coming in the next few weeks. There will be more Mississippians who die from this virus. It is serious, it is contagious, and it can be fatal.
But in the summer months, restrictions were lifted, leaving hospitals to request outside help and create ICUs in parking garages.
Half to 2/3 to 3/4 of your intensive care unit was made up of critically ill COVID patients. Didn't leave room for anybody else.
Then in 2021, health officials began rolling out the vaccine, but many Mississippians were hesitant to roll up their sleeves. Meanwhile, the virus began forming variants, leading to the highest number of cases in a day in January of 2022.
The virus has been smarter than we thought, was able to mutate and overcome our immune system. So we still haven't seen the end of that, I think. We saw those bumps, and those were the striking changes, but the virus is continuing to change and adapt.
Despite all we overcame, Dr. Threlkeld says it's put us in a good position for the future.
Going forward, I think we learned a lot, particularly about how to make vaccines, how to deal with crises like this, which I think will hold us in good stead if we have another epidemic of something else.
Now, that total number impacted by the virus here in Mississippi has totaled up to 999,756 cases and over 13,000 deaths. Holly Emery, 3 on your side.